The first thing you need to do is verify that you have an order to insert an NG tube. So we do. We verified the order. Then you want to grab your equipment. One thing you need to grab is your NG tube. Also a wash basin with ice, because as you're gathering your equipment, you would go ahead and put this on ice so it's stiffer when you go to insert. But right now, we don't have any ice, but that is one of the options that you could do. Along with your NG tube, you grab your clean gloves, some lubricating jelly, a tongue depressor, so you can press it against the tongue, and then a pen light so you can look in the back of the throat in case it gets curled. Water with a straw so the patient can sip and actually swallow the pH paper, bulb syringe, and then your tape for securing it and marking it. You want to go ahead and prepare your environment. You would grab a bath towel. The reason we have this here is so you can actually see it against the white. And then you would go ahead and make sure the patient's in high Fowler's, 45 to at least closer to 90 degrees, so you can get it, and then a stethoscope. You've already identified your patient. While you entered the room, you used hand hygiene. You explain to the patient what you're going to do. You're going to be telling the patient that you're going to be inserting an NG tube into the nose, down to the stomach, gastric area, for the reasons to decompress the stomach, to drain the stomach because of nausea, vomiting, some of the reasons why you would actually insert an NG tube. You would also have your suction set up, which is part of one of the equipment that you can grab prior to inserting your NG tube. You would also just let the patient know that there could be a possibility of gagging. You can have Kleenex available, so in case the tears, you can always wipe the tears later. And then you always should grab a faithful assistant to help, because as you're inserting the NG tube, you want to make sure that the patient actually swallows the tube, and that's why you have a faithful assistant to have them hold the water and the straw. Alright, so you're going to go ahead and open your package if you don't have it on ice already. Then you want to go ahead, then you open your package, you want to go ahead and measure. You want to do the tip of the nose to the earlobe. Go ahead down to the xiphoid process. Then you want to grab your tape, mark accordingly where you measured at, which is also called NIX. Nose, NEX, N-E-X, nose, earlobe, and xiphoid process. Little kind of reminder mnemonic device there. Go ahead then and put it back on your package. Go ahead and get your lubrication about 3 to 4 inches. Make sure it's nice and lubricated. Now you're ready for insertion, so why don't you go ahead and put your gloves on. Have your faithful assistant come around. I'm going to hand her the cup with the straw. Go ahead and make sure it's lubricated. You're going to take your non-dominant hand behind the patient's head, bring it chin to chest. With my lubrication, I'm going to go ahead and tell the patient to drink, 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 drink. So we're here to go ahead and grab with the non-dominant hand where you should be. Then we go ahead and grab our bulb syringe, just securing it slightly, just to temporary secure until we can check placement, making sure the patient is not gagging. Then we go ahead and grab our bulb syringe, pull back by depressing the bulb, hooking it up, letting it fill with gastric juices. Get your pH paper out. Check the pH paper to see if it's an acid. Should be around less than 5.5 on the, and visualizing that. If you do not have any pH paper available, what you would do then is grab your stethoscope, putting it in your ears, or you can have your faithful assistant do this. go ahead and squeeze the bulb. While it's attached, you squeezed, making sure this is over the gastric region. You want to squeeze and listening for bubbles that will go blah, 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 just like that. Once you know that you're in the right place, peach paper is not readily available. You do not want to necessarily order a chest x-ray or x-ray or chest x-ray because that's too costly to the patient unless you have no other option and you're not really sure, as long as there's no gagging. So then you would go ahead and properly secure your NG tube. After removing the temporary, you're going to go ahead, hooking it up to suction if that is an option, removing your gloves, securing it the proper way. Go ahead and put tape at the end with a safety pin, attaching it to your patient's gown, so clamping. And then you also want to do some oral hygiene if you need to. Dry up the patient's tears from insertion. Then go ahead and make sure you have the gloves on while you're doing your oral care. Go ahead and clean up your patient's area, making sure the patient is lowered and locked, the collar is in reach, making sure that the patient doesn't need anything else, and then you would go ahead then and get to documentation. Welcome to the nurse's station for documentation of your NG tube. Type of NG tube inserted, the nair used, how the patient tolerated the procedure, the method used to verify placement, observation of aspirant or pH, care provided, oral care, throat care, mouth care, and then any INO or output that has come out with suctioning, if you did hook it up to suctioning. One more thing, please remember, with inserting anything into your patient, you want to be sure to say inserted per policy and procedure, because that shows that you had somebody helping you, assisting in swallowing with the water, and so they were actually swallowing their tube. This concludes insertion of an NG. Welcome to the removal of an NG tube now. What we're going to go ahead and do is verify order that the NG tube should be DC'd or discontinued. We go ahead and enter our patient's room using hand sanitizer or washing our hands. Please keep in mind you can always use good old soap and water. Walk into the room, providing privacy. Go ahead and identify your patient orally or and verifying with the armband. Explain the procedure. We're going to be able to go ahead and take that out. I'm going to have you just take a deep breath, and then I'm going to loosen the tape and then pull out that NG tube. And then I want to listen to bowel sounds prior to assess the patient's nausea. So we would listen in all 4 quadrants of the patient's abdomen, obviously under the patient's clothes, going this route of the patient's colon. So you go lower to upper to upper to lower. Ask the patient if they have any nausea, vomiting, or any nausea. And then after the tube has been clamped, we want to make sure that the patient does not have any. We would go ahead then and grab some non-sterile gloves. And then we would go ahead and put on our gloves. Turn off. I would go ahead and turn off suction. Disconnect the tubing from the suction, allowing, then I'm going to check for residual. Squeeze, press, no residual with this patient. Go ahead and holding it just in case something wants to come out. And then I'm going to go ahead and ask the patient to take a deep breath, keeping in mind that we did place a bath towel over the patient's chest, because this will again be our work area. So we go ahead and disconnect the tape. I've already disconnected the patient's safety pin. I would have the patient take a big deep breath, coiling, 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 done. This has been DC'd. I would coil it around my hand. I would go ahead then and take my glove off, keeping that in there. Give the patient the box of Kleenex if he or she needed it. Disregard into the garbage. Lowering the bed. If I needed to measure any of the gastric contents in the NG suction, I would go ahead and put on gloves, check my suction canister to see how much the amount was, and then I would remove those gloves and then perform hand hygiene. Now it's time for documentation. Now it's time to document the withdrawal or the discontinuing of the NG tube. First thing we want to do is document the date and the time, the removal of the NG tube itself, and the condition of the tube. Also, how the patient tolerated the procedure, if there's any irritation to the nair or the throat, if there's any pain. Description of any drainage, any volume, we would document the volume. The assessment of the abdomen, along with the nausea, if there's any vomiting present after withdrawal. And then after we did the nausea and the vomiting, if anything is present after withdrawal, we would also make sure we assess the abdomen and bowel sounds and document that and what you found on the assessment. And then don't forget to end with safety. Bed lowered and locked, collet within reach, side rails up ×2. This concludes the withdrawal and of the NG